Hello and welcome to my YouTube channel. This is Dr. Alonso Osorio and I'm a board certified residency training emergency physician currently practicing in the state of Florida. I've been in medical practice since December of 2001 and specifically I've been a board certified residency trained emergency physician now for more than 10 years. I am double boarded in family medicine, so you guys know I'm a general physician who then not only did 3 years of family medicine background training, but I did also 3 years of emergency medicine specialty training. And I think that gives me the background, the necessary experience to give you an opinion on how I'm feeling about the current situation about coronavirus. Why do I feel that I need to give an opinion about this? Pretty much I want to bring some calm and facts to the population of the world that are literally panicking and remarkably worried about what's going to happen in the future. I'm going to tell you the perspective from me with my colleagues in the front lines on a daily basis and what it's been like for the last few weeks. Specifically, I want to let you know that this is a personal opinion. This is my own opinion. By no means this is related to my employer or the hospital system that I work with. And this is just my personal objective opinion based on the research and the information and also the recent experience that I had yesterday at the airport, which is what really led me to be here and talk to you guys about this topic. About 6 months ago, I had planned a ski resort trip with some friends and family. And obviously my wife and my 2 kids were ready, packed and ready to go. About 6 months ago, I bought some remarkably expensive tickets in the ballpark of $3,200 due to the huge peak season in the United States with the spring break that is started for my kids last Friday, for some others before, and is extending all the way into next week. Obviously, this spring break is going to be a little longer because, as you probably are experiencing, you're going to have your kids in your house and some of you are going to try to figure out what to do with your kids these days because they're now in the house and we need to keep them entertained. And obviously with this isolation, we need to find a way to do it. They're playing outside, so that's why I took advantage of this small gap to record this episode. So the kids are home. I'm home. I'm obviously not skiing anymore. And this is what happened. We make it to the airport around 1 p.m. We're meant to fly and everybody's packed. And this is, believe me, after some remarkable convincing and sitting down with my wife, explaining the reasons why I felt that it was potentially probably okay for us to travel. She had her own personal opinions and she's an asthmatic. My son is an asthmatic. I had done the commitments. I had the hotels booked, the plane booked. And everything was lined up to have a successful and joyful vacation. And my trips all got canceled. We got to the airport and the flight was delayed and they kept pushing it back until finally they told us to please approach the counter to get our money refunded or rebook or do whatever. So as you can see, and probably you have experience, you're getting emails from every single institution that you belong to or every subscription that you have, letting you know how they feel about COVID-19. And the hotels themselves and the airlines actually are having these specific issues with customers not flying. And for the same reason, they're trying to restrict the penalties related to booking this trip. So I just got a refund. They didn't ask me many questions. I got the $32.80 back. I got my hotel reimbursed. I canceled the car reservations with no problem. And we thought about still going. So my wife went on another app and immediately she booked a 4 round trip ticket for 4 people for less than $700 with taxes all included, one way from Tampa, Florida to Denver, Colorado, then to drive into Steamboat. We did that. We headed home and literally an hour or 2 after being home, we were notified that the ski resort had officially shut down So the vacation was never going to happen anyway. So I'm glad that I never really got to fly out. I feel bad for most of my friends that had made it earlier during the day. They didn't have any problems taking off. And I don't know what the role the Department of Defense decision play onto this. I'm just assuming and speculating because late last night I got an email and a Facebook notification that the Department of Defense had completely banned U.S. travels for their military personnel, and maybe this had to do something with it. Now, looking back, I'm remarkably apologetic towards my wife and my kids because all the convincing that I had to do to make them travel, I don't know if it was the most responsible thing to do. We have decided to hunker down home, and here we are in the house, obviously doing things around the house, enjoying ourselves, spending time together, and me trying to get a message to you guys. And I'm not regretting this, but the situation is critical, guys, specifically in the front lines, as I said earlier. As an emergency physician, we are there for you. We are there to make you better. We are there to help you out. We always have been there for you. And as an emergency physician, I feel extremely proud of being the backbone of the healthcare system in America. Because obviously private practices will be closing, individual physicians won't be seeing patients, and guess who's going to be there? Me and my colleagues. The College of Emergency Physicians has been supporting us. We're always obviously concerned, but not afraid. As doctors, we need to put our armors and our shields and our boots and head on to war and deal with the daily epidemic and potentially the pandemic. We really don't know what's the impact of this virus in our community because we are still not doing massive testing. From the epidemiological point of view, I don't think that everybody should be tested, just only those people that are high suspicion based on the recent travel and potentially exposure to patients with COVID-19. And also the bigger problem for us has been the fact that we don't know what condition we're dealing with. Many people are presenting with subjective concerns of fever, cough, myalgias, achiness, diarrhea, you name it. And some people are testing positive for strep. Some people are testing positive, I would say 80% for the flu. And I would say 10% of the people, I don't know what they're testing for. They look great. They have a little sniffles, a little bit of a cough. They have no risk factors. They're not diabetics. They are not cancer patients. They're not immunosuppressed. They don't have morbid obesity. They're non-smokers, and they look fantastic. So part of what I do after seeing 45 to 50 patients per shift is mostly education. And that's the education that I want to get out to you guys. My job is to make you think, not in a selfish way, but right now I need and we need your help to think us as a whole, as a community. We need the help of the community to aboard this public health crisis. We're currently feeling overrun. All the emergency physicians across the nations are feeling remarkably overwhelmed by the large amount of visits that we're having on a daily basis for minor complaints, people's walking in desiring to get tested. The testing is limited. Just a small percentage of the people are getting tested. We have reported a few cases within our own communities, and we expect that those cases are going to get larger and bigger. In my personal case, I'm taking precautions. I'm washing my hands with every patient encounter before and after. I'm entering the rooms with a simple mask, not the N95, a special mask, the more kind of face seal type of mask that you see out there, people probably at the airports. By the way, I was expecting to see many people yesterday with masks, and probably one or two, and people were kind of staying under control and keeping their distance. So I'm being careful on how I approach the rooms, no matter their concern. I do feel that eventually I'm going to get contaminated, I'm going to get infected, and we're going to need to deal with it. What do I foresee that is going to happen? We, emergency providers, doctors, we're going to need to be there eventually. I see myself potentially working infected, potentially working ill. I don't know if we're going to become the whole Italian phenomenon of not necessarily sending their doctors into quarantine and infected doctors taking care of infected people, infected nurses taking care of infected people. And I don't know if it's going to reach the proportions of massive health crisis with tons of cases requiring mechanical ventilation due to acute respiratory failure. What I mean by that is people on life support for breathing issues due to the fact that their lungs are just flooded with infection and swelling. Those are the small percentage of cases that we're seeing. As I said, if you guys really think about numbers, epidemics in America like obesity kill more people every year than COVID-19. Prescription drug abuse and heroin usage and opiate-related deaths are killing more people than COVID-19 every day. And the flu and cardiovascular illnesses are killing more people than coronavirus. I do understand that it's concerning. I do understand your fears. I understand your concerns for you, your children's, your elders. But we're there for you. And just remember, if you're truly ill, I'm not saying don't come to see us, but if you're truly ill, you have risk factors and you're feeling that you're flooding, come to emergency room. We're going to get you taken care of. But for now, if you're not really ill, stay home. If you just want to be tested because somebody sneezes 10 feet, 20 feet away from you, there is no necessity for that. The best thing that we can do for ourselves is wash our hands. That's all we need to do. And that's what we have been doing for hundreds of years. And it has worked very well in multiple prior epidemics. And obviously, to the isolation, respecting the boundaries in between people, avoiding crowded places is going to be the key. Right now, I'm going to be spending the week here with my family, working around the house, and I'm ready to come back to work next Sunday. I don't know what the future looks like. I do suspect that potentially we're going to see thousands of people infected coming through the doors. I don't know what's going to be the magnitude of these people, but I can tell you that it's a very small percentage, but that small percentage is just large enough to completely occupy our hospitals and obviously the intensive care units. And I don't want this to become the Italian model of war times on healthcare. That's why we went into a state of emergency for us physicians, hospital systems, and the healthcare system to establish plans and the means to determine how to best allocate resources, how to attend people when we're in full capacity, and what shortcuts we are going to need to take to do a better job at taking care of these ill people. One huge favor I'm going to ask from all of you guys is we're there to help. Remember, we have wife and kids at home like you do. Don't come and insult us. Don't come and curse at us. We don't deserve the physical and verbal abuse that we're experiencing these days. Just try to avoid gathering in the waiting room of any emergency room across the country with people coughing all over you. And be self-conscious. I think solidarity is going to be a critical thing in this epidemic, and we're going to need to help each other. We don't know exactly how this is going to impact our society. I think we're ready. We've been ready for this for many years. This is what we trained for. Obviously concerned about the political, economical situation for the United States and for the world. As a foreign and an immigrant to this country, I still have family in Colombia. I can tell you my nephew and my niece are stuck in Colombia during the spring break, and they might not be able to fly into the US. And if they make it into America, I don't know if you guys have noticed how crowded the immigration lines are, but it's completely unpredictable. I don't know if the traveling between the states is going to be completely banned, at least by air. I don't know, by ground. Obviously, we're not a communist, socialistic country that implements significant laws, and people get heavily penalized if they don't help with the social welfare. But in this situation, since this is a free country, and I'm asking you to stay home and stop being selfish and be mindful that there might be other people requiring emergency services. Also, be careful at dialing 911 just to get an ambulance for transportation to the emergency room for your 3 years of abdominal pain or your mole in the forearm that has been there for 6 months. I mean, I know that the ambulances cannot take you down. I know that some of you are using ambulances to make it to the hospital as a transportation mode, but this is the moment, I think, for us Americans to really put a hand on our heart and start realizing that the resources that we have are limited and that any day they could cease to exist as they are. I hope that we will overcome this like the human race has always done. I think this is an extra epidemic. I think 2 years from now we're going to be laughing at this. But as of now, it has killed a lot of people. I feel bad for the families of those people that have been affected. I feel bad for the families and the emergency physicians, 2 of them in critical condition that are currently infected and very ill. I don't want that to be me. I'm going to be there for you guys. Just try to keep it cool and collected. And all I can say is we have to pray and be smart about this. And by the way, I don't understand and I have no clue why you guys are completely obsessed with buying, some of you, not all of you, buying hand sanitizers and toilet paper. Remember, you need to use common sense. Hand washing, protecting your cough, isolating yourself, and having a public community solidarity mindset is going to be crucial for the next weeks to come. Having said this, I have a guest coming into my podcast next Tuesday. We're going to be recording an episode with an infectious disease specialist that has been closely following this coronavirus epidemic from her specialty perspective. She's a foreign medical graduate, and I'm super excited to bring her into the show. I think it's the right moment. The community needs this, and objective information is needed, unbiased information coming from a practitioner on the front lines. I'm there for you guys. If you're sick, emergency physicians, emergency nurses, paramedics, technicians, everybody that works in emergency healthcare will be there for you. But also have some common sense and be conscientious about the commonwealth and the common goodness, and be mindful. Thanks for watching and thanks for listening. Please subscribe right here, and you're gonna be made aware of my future incoming videos. And don't forget to visit my website at www.fmg-imgcast.com. You can find me on iTunes, Spotify, Radio FM, iHeartRadio, future in Pandora. I'm going to be soon Google Podcast, SoundCloud, Spreaker Radio, Stitcher Radio. You can find me pretty much in every single platform if you look me up under the Foreign and International Medical Graduate Podcast, or you type my name, Alonso, Alonso Osorio. Leave me feedback, a message right here at the bottom, and there's going to be a link to my podcast, and thanks for watching.